Every year, millions of seniors line up for routine checkups, believing they're doing the right thing for their health. But what if I told you that some of those harmless tests could actually be pushing you into danger? New research shows that routine screening can backfire. Up to half of older adults get at least one unnecessary test, and the harm from these can outweigh any benefit. For example, a 2020 NIH study found at least 50% of seniors underwent cancer screenings they didn't need. Even scarier, a 2025 UC San Francisco study warns that CT scans, a common screening tool, may account for 5% of all cancers in the US. That's a risk on par with heavy drinking or obesity. You won't hear these numbers at your doctor's office or see them on TV. The truth is buried in the science. In this video, we're exposing the 5 health checkups you should avoid after 70 and the terrifying reasons why, all backed by real studies. And you won't believe what made it to number 1. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure? Do you think seniors are tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's dive into the first test on our list. Number 5, frequent bone density scans, DEXA. Many seniors diligently get annual bone density tests, DEXA scans, to check for osteoporosis. At first glance, it seems harmless. We all know that weak bones lead to fractures and poor quality of life, especially as we age. Doctors often say, better safe than sorry, and order a scan. But here's the catch. For healthy older adults, repeating bone scans too often adds almost nothing to your safety, and it can quietly lead to harm. In one Harvard study, researchers followed healthy 75-year-olds for years and found that repeating the DEXA scan every 4 years improved fracture risk detection by only 4%. In other words, scanning frequently catches almost no additional problems, yet each scan can create anxiety and trigger prescription drugs. Consider this real-world example. Marion, 78, was told to get a DEXA scan every 2 years, just to be sure. Her results came back barely below the cutoff, and she was put on a powerful osteoporosis drug, a bisphosphonate, to strengthen her bones. A few months later, she developed a strange jaw pain and was shocked to learn that her medication had caused jaw osteonecrosis, essentially the jawbone dying, a rare but serious side effect of these drugs. Her routine bone scans set off a chain of events that cost her her dental health. The hidden truth is this: if you're healthy with no major risk factors, a single baseline bone scan is usually enough, and repeating it every year or 2 is overkill. Doctors now suggest spacing scans further apart or focusing on lifestyle changes instead. Weight-bearing exercise, vitamin D, and calcium are safer ways to protect your bones. If your last bone scan was normal, skip the next one, or at least ask your doctor whether it's truly needed. Remember, no test is dangerous by itself, but unnecessary testing can push you into an endless cycle of medication and worry, with side effects as deadly as jaw necrosis. But hang on. Even though the scan itself seems just checkup, number 4 on our list is even more surprising and potentially harmful. Number 4, mammograms for older women. Mammograms have become almost a sacred ritual for women, often from age 50 onward. Many senior women continue to get yearly breast X-rays well into their 70s, thinking it's essential. After all, early detection of breast cancer saves lives, right? But in seniors, the equation changes. The benefit of finding a tiny tumor years before it causes symptoms is outweighed by the risks of overtesting. Here's what the science says. Experts recommend stopping routine mammograms after about age 75 for average-risk women. Yet many doctors still push annual screens on healthy 78-year-olds. One surprise is that mammograms expose you to radiation, small but cumulative, and often lead to unnecessary biopsies. Harvard Health warns that many mammogram results turn out to be false positives, triggering biopsies that show no cancer at all. This creates stress, pain, and even surgical scares where none were needed. Imagine 72-year-old Linda, who dutifully had a mammogram every year. One year, the radiologist saw a tiny shadow and sent her for an ultrasound and biopsy. It turned out to be nothing, but the fear and invasive needle procedures took a huge emotional toll. Meanwhile, Linda never gained any benefit from all those scans. In fact, every time she lay on that X-ray table, she got a bit more radiation in her breast tissue, and as the UCSF study suggests, more radiation exposure raises long-term cancer risk. So her routine safety check was actually piling on risk. The safer approach. For women over 70 who are otherwise healthy, it's wise to discuss whether a yearly mammogram is truly necessary. Many specialists suggest stopping mammograms around 75 if previous results were normal. Instead, women can do regular self-exams and clinical checkups. If any lump or issue is felt, then pursue imaging. In short, be selective. Mass screening past 75 can cause more harm than good. Number 3 on our list is another routine test, and one that many older men and women get blindly. Number 3, PSA, prostate cancer screening. The PSA blood test for prostate cancer has long been part of older men's annual checkups. Even after 70, a lot of men continue getting it, believing catching cancer early is everything. But here's the truth. After a certain age, PSA tests almost never save lives and frequently cause harm. First, consider what happens when a PSA comes back high. You're often sent for a prostate biopsy. These biopsies are invasive. They can cause infection, bleeding, and severe discomfort. Studies show PSA screening in seniors typically catches slow-growing prostate cancers that wouldn't have killed them anyway. Yet once you know you have it, almost every man chooses treatment. Harvard Health explains that many older men who are overdiagnosed by PSA will undergo surgery or radiation, even though that slow-growing cancer would never have shortened their life. They then suffer from impotence, incontinence, and other side effects for no real benefit. Take Sam, 74. A PSA caught a very small tumor. Believing any cancer is lethal, he underwent radical prostate surgery. Today, his cancer was never going to spread, but now Sam struggles with lifelong bladder leaks. What might have been a non-issue became a nightmare. Current guidelines actually say most men can stop PSA screening around age 70. In fact, some experts now recommend against routine PSA testing at any age for healthy men. The risk of false alarms far outweighs any tiny chance of benefit in older age. A smarter approach is to discuss it with your doctor and consider active surveillance. Skip the PSA if you have no symptoms and focus on overall health. If you have urinary symptoms or other red flags, look into those specifically. But don't do PSA just because. So that's number 3. But number 2 on our list is a test that feels like it should save lives until the hidden risks hit home. Number 2, colonoscopies, colorectal cancer screening. By now you've probably heard that colonoscopies can save lives by removing precancerous polyps. And while that's true for middle-aged adults, for many seniors, the story is different. People over 70 often think, I should keep getting colonoscopies to be safe. But after a certain point, the procedure's dangers climb steeply. For one, seniors face a much higher complication rate. A large study found that adults 75 and older had a 6.8% complication rate within a month of an outpatient colonoscopy, more than double the 2.6% rate seen in younger patients. These complications include perforations, severe bleeding, heart or lung issues, even death. In fact, colonoscopy perforations are roughly 30% more likely in seniors than in younger patients. There are real cases where a routine colonoscopy at 78 led to a torn bowel and emergency surgery. On top of that, remember the statistics. The average life expectancy for someone in their late 70s is often less than 10 years. Since slow-growing colon tumors might take a decade or more to cause trouble, a new colonoscopy rarely helps them, and often just causes harm now. Medical ethicists even tell the story of an 80-year-old man who died during emergency surgery to repair a colonoscopy perforation. He was healthy, worried more about undetected cancer than the test itself, and tragically never got the chance to find out either way. Official guidelines actually recommend stopping routine colonoscopies around 75 for average-risk adults. Beyond that, the risks outweigh the benefits, especially if you're in good health. A safer approach for many seniors is to stop doing colonoscopy after 75, unless you have specific concerning symptoms like bleeding or weight loss. Instead, some doctors suggest annual stool-based tests that are far less invasive, or simply skipping the test if your doctor agrees you're low risk. Imagine your grandmother, 80, insisting on a colonoscopy after her 78th birthday, even though her last was clean. The doctor warned her it might not be worth it, but she insisted for peace of mind. They proceeded, and during the prep, she suffered dehydration and an arrhythmia that sent her to the hospital. The final report: no cancer found. This kind of scenario, where a preventative test leads to an emergency, is one of the hidden risks seniors face. So that brings us to our final item. You might think it can't get worse than risking tears and death from a colonoscopy, but number one is truly shocking. Number 1, full-body CT scans and other high-radiation imaging. At number 1 is a test that barely feels like a checkup, but is surprisingly common. CT scans for screening purposes, sometimes called full-body scans or virtual checkups. People in their 70s sometimes get annual CT scans of their chest or head, just to be sure. The intention is good. Find any hidden tumor early. But this is probably the most dangerous one on our list. Why? CT scans bathe your body in ionizing radiation. We used to think a single scan was harmless, but modern science begs to differ. Just this year, UCSF researchers published a bombshell. CT scans may account for up to 5% of all cancers in the US. That means something like 100,000 new cancer cases in 1 year could be linked directly to radiation from these scans. To put that in perspective, CT imaging now carries a cancer risk comparable to heavy drinking or obesity. It's not negligible. And older adults get lots of CTS. The study found adults had the highest number of CT scans, especially ages 60 to 69. Imagine you thought you were being responsible by screening for heart disease or lung problems with a CT. You might unknowingly be giving yourself a ticking cancer bomb. Consider the case of Frank, 75. After several health scares, he opted for an annual whole-body CT each year, thinking it would catch anything early. Last year, a scan did spot a tiny spot in his lung, which turned out to be benign. But Frank later developed prostate cancer, and his oncologist mentioned radiation exposure is a known risk factor in his age group. Frank now wonders if his routine scans, not heavy drinking, were a big part of his cancer risk. Alternatives. For most screening purposes in seniors, there are safer options. For example, to check the heart, an ultrasound, no radiation, or a stress test might be enough instead of a CT angiogram. For suspected problems in the abdomen, MRI or ultrasound can often be used. And of course, any imaging should be guided by symptoms, not done just in case. The main thing is, don't use radiation scans as general checkups after 70. If your doctor orders one, ask if it's truly needed or if a no-radiation alternative is available. The scary truth is, one of the most common imaging checkups is actively linked to cancer risk at the population level. Most patients and even many doctors don't realize this. If there's one test on this list you absolutely shouldn't do routinely, it's a full-body CT or repeated high-dose scans. Wrap-up modern medicine is powerful, but sometimes less is more. We've seen that for seniors. Piling on annual tests and scans can do more harm than good. Routine bone scans can trigger dangerous medications. Mammograms often cause needless biopsies. PSA tests lead to overtreatment. Colonoscopies carry serious complication risks, and CT scans can even cause cancer. All of this is backed by real data. If you're over 70, have a frank discussion with your doctor about each test. Ask if it's truly necessary or if an alternative exists. Sometimes that means focusing on exercise, diet, and selective checkups rather than blanket screening. Every patient is different, but keep in mind that experts now advise stopping many routine screenings around age 75. Trust your body and your doctor, but remember that standard practice isn't always right for everyone. What do you think? Did any of these surprise you? Have you or someone you love had a scary experience with one of these tests? Let us know in the comments. We read every single one and reply with tips. And if you found this video helpful, Please hit like and subscribe for more senior health tips. Thanks for watching and stay informed.